What is OCD, or obsessive compulsive disorder? When you think of it, what pops into your head? According to research by Derna and others, obsessive compulsive disorder is a seriously disabling condition often described as having repetitive, unwanted, and intrusive thoughts, images, or urges and ritualized behaviors that are performed to reduce distress. Let's break down the disorder with help from the International OCD Foundation. As defined by them, obsessions are thoughts, images, or impulses that occur over and over again and feel outside of the person's control. An obsession with OCD is different from typical obsessions in that the intrusive thoughts caused by OCD are frequent and relentless. They cause immense anxiety, fear, and disgust. Everyone has intrusive thoughts, but not everyone has OCD. Also, as defined by the International OCD Foundation, compulsions are repetitive behaviors or thoughts that a person uses to neutralize or counteract the obsession. Some people compulsively shop. So what makes this different from having OCD? The feeling and the motive. Those without OCD who compulsively shop do so because shopping is something they internally prefer or enjoy. However, people with OCD who compulsively shop do so when they would completely rather not, as their compulsivity is time-consuming and torturous. Everyone is compulsive at times, but not everyone has OCD. As most of you probably already know, mental health disorders are often heavily stigmatized. OCD is not divergent of this. According to Derna and others, when a person's OCD symptoms do not conform with the norms of society as some symptoms might, the possibility of being subject to exclusion, discrimination, and stigmatization may increase with hostile attitudes. This stigmatization often causes a delay in treatment-seeking behaviors, which can be extremely harmful. Now, according to a qualitative study by Rebecca Pedley and others, it's not only other people's perceptions of OCD, but the perceptions of the sufferer themselves as well. The common sense model of self-regulation is a framework for understanding that claims that treatment-seeking behaviors directly depend on an individual's perception of their illness. This model yields evidence that illness perceptions are associated with coping and patient outcomes across a range of health conditions. This means that a person's ability to seek help and to benefit from help relies heavily on how they themselves perceive their disorder. Still, people are influenced by society. If society stigmatizes OCD, then so will the individual suffering from it. I'd like to note that I have been professionally diagnosed with OCD and have personally experienced the stigmatization that I have been discussing. I have often heard my peers say things like, "I get OCD sometimes," or "I am really OCD about X," or "I'm a little OCD." These statements are not only grammatically and medically incorrect, but they are also extremely harmful. They minimize the experiences of people with actual OCD. To be correct, obsessive compulsive disorder is a mental health disorder that imposes on my everyday functioning and is not a personality trait. Thank you.